All right, we'll go ahead and get started. So, good afternoon, everyone. Welcome to the Rapides Foundation's informational webinar for the Cenla Mental Health Workforce Accelerator Program grant. And let's see, Angela, if you can go to the next slide. So I'm Ashley Stewart. I'm the Director of Programs for the Rapides Foundation. I oversee all of our grant making here at the Rapides Foundation. We also have speaking today Angela Williams. She is with the Rapides Foundation and is the Program Officer for the Healthcare Access Initiative, and she'll be the main point of contact for this funding opportunity. And we also have Rachel Kessler. She is with the National Council. So the Rapides Foundation has partnered with the National Council to provide technical assistance to us and to the grantees for this funding opportunity. They've got a wealth of background and very similar work. And Rachel will introduce herself and the National Council a little later in the presentation. So next slide. So here's the agenda for the meeting today. We already covered introductions. We'll do a brief background on the Rapides Foundation, cover the purpose of why are we supporting this program, and then review the request for application, key materials, and the key details in that. So next page. So the Rapides Foundation service area covers 9 parishes in central Louisiana. Here is a map of those 9 parishes so you can see where they're located and also a list of them. All activities that are funded by the Rapides Foundation must take place in those 9 parishes and serve the community in the 9 parishes. Next slide. So the mission of the Rapides Foundation is to improve the health status of Central Louisiana, and our vision is to positively impact Central Louisiana by deploying resources to improve key factors of health status. And we group those health status into 3 categories. You go next slide. Healthy people, education, and healthy communities. Our work in healthy people includes our health behaviors initiative, where we focus more on the prevention side of things. So we do healthy eating, active living, tobacco prevention and control, and substance and alcohol abuse. And also under healthy people is where our healthcare access work falls, which is what this program is about. Our largest funding piece is education. We work in birth through post-secondary to increase the level of educational attainment. And under healthy communities, we have an economic environment initiative where we work to increase family income, and the social environment initiative where we work to increase social and community engagement and also to build the capacity of nonprofit organizations and leaders. So next slide. So as I was saying, the Cenla Mental Health Workforce Accelerator program is part of our healthcare access initiative, but it doesn't work and it's alone. We have several components under healthcare access, one of them being primary care access, which includes behavioral health. We also have medication access and early cancer screening programs that are operated by the CMAP organization. And the medical manpower is the 4th component, which is where this falls. So go ahead. So we've been working to address the behavioral health workforce for several years. In 2017, we provided a grant to NSU to help start their site mental health nurse practitioner program. LCU, we helped start their Masters of Social Work program in 2017. LCU also has a healthcare occupations program grant that helps to increase the number of graduates in their social work program. And most recently, we funded the Louisiana Mental Health Association for a suicide prevention grant called the Fisher Project. So that's a little overview of what the Rapides Foundation has done to address the medical manpower issues around behavioral health over the years. And so now I'm going to turn it over to Rachel to introduce herself and to talk about the National Council.
Thank you, Ashley. Hi, everyone. My name is Rachel Kessler. I'm a senior project manager with the National Council for Mental Wellbeing. The National Council is a nonprofit national association that represents over 3,400 mental health and substance use provider organizations from across the country. Our main vision is that mental well-being, including recovery from substance use, is a reality for everyone, everywhere. And we do that through public education work, training, and capacity building and activities, and by influencing policy and systems change in the field. And we know through our work that workforce is one of the top most consistent challenges that our members face across the country in this field. And so, as Ashley mentioned, a big part of why we are here today is because in 2023, we partnered with Kaiser Permanente to launch the National Mental Health Workforce Accelerator. And that program aims to increase the number and diversity of qualified licensed mental health and substance use treatment clinicians. This program model, which we'll go into a little bit more detail later, but just to start, it first launched in Colorado and Georgia, and since has expanded to Washington, California, and Hawaii. And overall, it works to reduce barriers and increase supports for folks on their path to clinical licensure in the mental health field in order to get more quality mental health services to those that need it most. And so we are very honored to have been working with the Rapides Foundation to launch a version of this accelerator model through this opportunity that we're going to talk through today.
And so when it comes to the Rapides Foundation, those of y'all have worked with us before, you know we always do things based on data. And so when we were putting together this funding opportunity, these are some of the statistics that we use to guide our work. This is information from the Rapides Foundation's Community Health Assessment, which can be found on our website. We've been doing this assessment every 3 to 5 years since 2002. So we have a wealth of information and several trends to see how the community what their health status is and how they're doing. Some things that we have seen is there's been a steady increase in the percent of community members reporting their mental health is fair or poor. We've also seen an increase from 27% in 2013 to 42% in 2024, with people reporting 3 or more mental health days, 3 or more poor mental health days in the last month. This assessment also shows that 30% of the population reports a depressive disorder and 44% have experienced symptoms of chronic disease. So when we look at is there workforce available to support this, you can go to the next slide. We know that all 9 parishes located in the foundation service area are considered as having a professional mental health shortage. It's across the board. All 9 parishes do not have the level of mental health workforce that they need to meet these needs that we're seeing continue to increase. But we know that there are some good news that the training providers, such as NSU and LCU, are graduating several. Statewide, we know that there's an average of 780 master level counselors and social workers each year that are graduating with a master's degree. But national research shows that only 43% of those graduates obtain their licensure. And so what this funding opportunity is about is really bridging that gap and providing that over 400 graduates support that they need to move on to that next level of professionalism and gain their licensure so that they can provide services within our 9 parishes. And so that is the background of how we got here and the data that we've used and just really that gap that we're trying to address with this funding opportunity. So with that, I'll turn it over to Angela to dig into what this funding opportunity is about.
So as you know, the name of our funding opportunity is the Cenla Mental Health Workforce Accelerator Program. And so you've heard a little bit about, the reasons why. So the purpose and the goal is really to identify local organizations to implement the accelerator program by filling the role of responsibilities of a regional chair, and with the goal to increase the number of highly qualified behavioral health licensed clinicians in Central Louisiana by implementing a licensure accelerator program. The program will support 30 behavioral health professionals, which we're calling candidates, in obtaining their license, whether it be a licensed clinical social worker and/or a licensed professional counselor. And Rachel, you want to talk a little bit about the modified version?
Absolutely. So as Angela just introduced a little bit more about how this model works, is mainly to support those master's level pre-licensed clinicians who have the intention and are committed to achieving clinical licensure, the LCSW and LPC for this program. And we are calling them candidates. And so what this program will do is identify sites or organizations that will employ and really support these candidates in positions where they can achieve licensure and be able to accrue those hours, client-facing hours towards their licensure. And as Rapides introduced before as well, we want to ensure that these sites and organizations are within the 9 parish service area in Louisiana. And so this program will offer just various supports to help these candidates be successful in their journey to licensure. Some of these will include providing clinical supervision. We know sometimes that's a barrier to achieve licensure. So if these sites don't have the capacity to provide it for candidates, this program will ensure that candidates get that clinical licensure time. It will provide other supports that can include licensure examination prep materials, potentially financial support there, learning opportunities, professional development opportunities, connection to peers, also going through a similar journey in the program, and much more that the regional chair, and we will partner with the regional chair to help design the details of those supports that will be offered.
Okay. Some of the program key partners, as Rachel mentioned, is the National Technical Assistance Provider, which will be the National Council. The regional chair is whomever we award the grant to. Placement sites will be those locations within the 9-parish service area that agrees to participate in the program, as well as employ the candidates that will be placed in their area for work. And then, of course, the candidates will be those individuals who are have their masters in either social work or as a licensed professional counselor and are requesting to apply to the program. Academic partners would be those organizations such as yours that might be part of the key partners. In-person or virtual clinical supervision. We do have one provider who is a preferred provider, which is Motivo, to provide virtual clinical supervision, but also the regional chairs can evaluate in-person individuals in our 9-parish service areas that may be able to serve in that capacity. And then, of course, key partners for licensure and exam preparation, which we currently have a preferred partner, which would be Triad. Key activities of the regional chair would be program management, partner recruitment and management, partner application, selection and onboarding, training and technical assistance, evaluation and performance monitoring, marketing and communications, and fiscal management. You can find additional details as to all of those key activities in the RFA. We do have some program non-negotiables that we felt was important to point out. Under program management, we want to ensure that the program ensures that candidates receive the required supervision for licensure. The program must provide candidates with exam preparation for the licensing exam and cover the licensing fees. The program must include networking and cohort learning opportunities for the candidates and the sites. And the program must identify candidates to work in the service area for 2 years after receiving their license, or they will have to pay back the candidate support expenses, estimated around about $20,000. Also coordinate and facilitate the placement of candidates at sites to obtain the required hours towards licensure. Under the department and recruitment, the non-negotiables are to select placement sites that will pay candidates and provide benefits. Select placement sites that will employ and support the candidates to complete their required hours towards licensure. Select placement sites in the Foundation's 9-parish service area, as we've mentioned. Placement site priorities should be given to organizations that serve under-resourced, rural, or marginalized populations. And then under fiscal management, we wanted to point out that funding cannot go to pay any outstanding balances that the candidate may owe to the post-secondary school. Competitive applicants must possess the following: must obviously provide services in the 9-parish service area, demonstrate professional leadership in the field of health, mental health, and/or public health, technical expertise and experience with mental health and/or healthcare workforce development, have proven ability to advance health equity by addressing root causes of health disparities and complex health challenges that involve multiple stakeholders and sectors, relevant network and professional relationships with critical stakeholders, and demonstrate fiscal responsibility. Eligibility requirements, the following are requirements, which is you must be classified as a Section 501c3 tax exempt organization or a government entity. Cannot be a private foundation under Section 509A, And if you are an academic institution, you must be accredited by SACS or COE. In regards to the grant terms, this will be up to 48 months, beginning July 1st, 2025 through June 30th of 2029. This does include a 3-month ramp-up period, which will start July 1st of 25. Again, this is a competitive grant application process, and available grant funding from the Rapides Foundation is limited. Funding must be used to support the operations and administration of the program. The foundation also reserves the right to grant less than the total amount requested, and all funded projects must be offered again in the 9-parish service area. Under funding guidelines, the budget must include a candidate support expense of $40,000 per candidate. And the allowable expenditures are listed: staff time, candidate salary, stipends or incentives, licensure fees, exam preparation support, supervision support, in-person convening support, registration fees for state and or national conferences, travel expenses, and indirect costs. I'm not going to go through all these, but these are listed in the RFA, but these are the non-allowable expenditures. So please review the RFA before submission. Accountability and reporting. I know that both of y'all know that you will have regular calls with the foundation, which will be with me. It will either be monthly or bi-monthly. And then your interim reports are due to the foundation every 6 months. A reporting schedule will be established upon selection of the regional chair. And we do have regional chairs there. I want to just mention that because it's possible that we could choose 2, and they would be considered co-chairs. We are offering a pre-submission consultation call. Each applicant can sign up for 1 pre-submission consultation call. The calls we have blocked for Mondays from 1 to 2 Central Standard Time and Wednesdays 9 to 10 a.m. Central Standard Time, January 15th through the 19th. However, you must book that call prior to March 7th. We will drop in the link. I think Ashley's going to help me do that in the chat. The link to the pre-submission consultation for you to book your call, but you can also go to the website under the grants page, and the link will be there as well. All right, for key dates, thank y'all for joining today's call, or the informational call. You can see there that we have listed when you must submit your pre-submission consultation if you want to participate in that call. Applications are due March 28th by 4 p.m. I do just want to mention that those are that is a hard stop at 4 p.m. So make sure you give adequate time to upload at least 2, I would say probably 3 hours to upload it to the portal if you're waiting to that day. Because at 4 o'clock, if it comes after that, we cannot accept it at that point. That's just to make it fair for everybody. Notification of selection will be May 30th. And as mentioned previously, we do have a 3-month ramp up start date of July 1st. We will have a mandatory onboarding kickoff call somewhere between July through September, and then planning meetings will be determined after that point. All right, the submission process. All applications will only be accepted online. The online application is located on the foundation's website under the grants tab. The application deadline for submission, as mentioned, is no later than March 28th at 4 p.m. Central Standard Time. This is just a quick screenshot of where it is on the foundation's website and what it looks like. It is under the grants tab. You will see to your right-hand column where you register for the informational webinar. And then down below, I just want to mention the application submission process. When you start that process, if you do start new application, that will start an application on the portal. But if you need to go back into the application, make sure you do return to my application, or you're going to start a brand new one. So we don't want you to have multiple applications out there and not knowing what's in what. I think that would be a little confusing, but just wanted to point that out to you. Okay. Also, you can't see it here on the screen, but you will also find the link to do the pre-submission consultation call there as well. Okay. When you do log in to the portal, I just wanted to point out you will need your tax ID number. So make sure you have it available to you when you start the process for the application. Okay. And of course, if you need any assistance, you can contact me regarding the funding opportunity. And then if you do need assistance regarding the online portal and a submission of the proposal, our assistant here at the foundation, our program assistant is Courtney Keys, and her information is also available to you. All right, we're going to stop for questions for just a few minutes. See if there's any questions.
Well, I have a question.
All right, Steve, I figured you would.
So I I understand that the participants, no, the candidates would each receive up to $40,000 in support, and I want to make sure that I understand. Is it 2020? Let's say that the intern or that the supervision takes 2 years. And so is it that there would be $20,000 that would be eligible that would be available to pay for the candidate's first year and 20,000 to pay for the second year, or is it is that 40,000 including not just stipend or not just stipend, but also all the additional support such as test prep assistance, supervision, and so on and so forth?
So the way that that 40,000 came about is from the National Council's other programs. All of the placement sites receive funding to pay for a portion of the salary for the person who is there. So the way that it was calculated is we were thinking $20,000 for half of a salary for the first years and $20,000 for half of the salary for the second year. We left a little wiggle room and didn't come out and just say, hey, this is for salaries, but we do know that in the other programs, that is a very large carrot to get the placement sites to participate. But we did want to give you a little space to be creative if like a portion of that could be used for maybe retention or, a bonus at the end, or, to have those conversations to see if there was a different way to use that 40,000. But I think, based on the other programs and the way that we came to that number was that it pays for a portion of the salary. And so actually the placement sites invoice the regional chair monthly for the salaries of those candidates.
Understood.
Yeah, and I did have in there that a certain portion of it could be reserved to support engagement in the community, because we want them to stay here. We want them to feel connected and a part of the community, and so some ways to help them do that. I think it was 5% that we set aside for that use, but again, those are optional.
Got it. And then that 40,000 is separate from the money that is spent on behalf of the candidates, plural, to pay for exam prep, continuing education, supervision fees that may need to be paid to the supervisor, et cetera, et cetera. Those are kind of apples and oranges.
Exactly.
Got it.
Also, too, there is a possibility, we kind of talked about this here at the foundation, that a site has an individual already working for them and is already receiving a salary. So that would be something that we would have to consider, because how would we look at that? How would y'all look at that? So maybe you wouldn't use all your salary dollars because you may not have to pay all of the salary or portion of it. So that's just another thing. There may be someone already working. There would have to be some looking at their job responsibilities and all of that before that candidate was considered to be approved. Does that make sense?
Yes.
And I know there was the 2-year work back was based off of and if they do not complete that work back, it's a $20,000 payback. That payback is because that's a rough estimate of how much those additional supports cost. So like that's how much we were estimating the supervision would cost, the exam preparation, the test fees, and then also a portion of the regional chair's time to organize and coordinate those pieces. So I did want to make sure that you're understanding that we're not asking for them to give back their salaries, but that this is what the support would cost and those additional things that they were receiving besides those salaries.
Understood.
Any additional questions?
Okay, so I just want to make sure that I'm clear on what you said about potential candidates. So it could be potentially someone that's already started the process, like they're already working with an LMSW and they're working toward it, but they may be like not as far. I mean, it sounds like it might be better if they're not as far into it, like if they're more at the beginning stage. Am I correct in understanding that?
I think the priority would go to those that have not started the process.
Okay.
Or, I think we'd have to kind of discuss that, but I think priority would be for those who have not started the process yet. They could be working, but have not started that supervision process to go that way.
Okay, thank you.
May I ask one more question?
Absolutely.
So this is a 4-year project, and the goal is at the end of 4 years, there would be 30 new licensed clinical social workers or professional counselors. And my assumption is that it takes roughly 2 years to complete the clinical supervision and successfully pass the licensure exam. And so I guess I would imagine a situation in which we would have different cohorts of students as they graduate or as we identify them. But we don't expect to have one gigantic graduation ceremony with all 30 on the last day of the grant. Instead, they would be trickling out, or rather trickling in and trickling out over the course of 4 years.
That's the goal.
Gotcha.
But I would say it would be kind of neat at the end of the 4 years to bring all 30 together and just have one big picture of all of them. That would be kind of neat.
Yeah.
Right. And just to mention, we know that there will be support because you will be working with the cohorts as the regional chairs and making that cohesive connection and helping them work together, it's really to support them in the process. And so getting to know them and helping them through the process. And so they probably would love that at the end. Okay. Any other questions? No? All right. Well, we'll go on. And then if you
I
think,
did want to stop and ask a national council if there was anything that they wanted to interject with any of the questions that were asked or things that you wanted to share related to those with some of the other programs.
Ashley, Angela, I honestly think you answered them perfectly related to that, and just emphasizing the cohort model too. I think that might be a part of the application process. But for example, if it starts in September, October, maybe you're trying to recruit, 5 to 7 initial candidates to start. Then maybe 6 months later, you're looking for another 8 candidates to start, and kind of working with that budget and structure there. That's kind of how the other states have done it. They've like steadily increased the amount with the goal of everyone can hopefully achieve their licensure by the end of the 4 years. Exactly like you said, Stephen, like trickling in and trickling out depending on the cohort. And if folks need a little bit longer, then maybe that can work as well with the program.
Agreed. And we've tried to align those dates around graduation. periods. And so noting that most of the candidates would be graduating from their master's degree program in May. So hence the July start date. I think we need to do a little more research around how many December graduates are coming out of these programs. So then we would adjust numbers to be a bit more realistic.
And I'm so sorry, we did not introduce Anthony. So Anthony is also with National Council and has been working closely with us. So yeah, that is who he is. And I apologize, Anthony, for that.
I just jumped in there. Yeah, no worries.
Not a
Okay, I'm
random. He knows
sorry.
a lot about the project. Yes,
I'm
I
sorry.
should have said something as well. Anthony, I've been
Oh.
working closely with the other project. Yeah.
I did also want to point out about those slides that were program non-negotiables. That's something really to look at when you're developing your budget and your staffing, to make sure that, as you're developing your budget, you have a budget in there for, like what y'all mentioned, for the licensing prep. You have a budget in there for the supervision. You have a budget in there for the salaries, the $40,000, and then also to help you manage, and figure out what does that staffing look like, to manage all of those different components, to manage the coordination and logistics of those different pieces. So just did want to, make that connection of really pay attention to those non-negotiable pieces when you're looking at your budgets.
All right, well, talking about budgets, we'll talk about the grant application and the key materials. So the key materials is obviously the RFA. So you're going to submit an application to us. We'll have a signature page as well, and then there will be a work plan and timeline, budget worksheet, and a narrative. Then, of course, if you're a nonprofit, you will have to provide us your status and designation letter, your accreditation from your schools if you're an academic organization, and then your most recent IRS 990, excuse me, and then any key staff resumes or job descriptions for anticipated staff. In the application, the first component is the organization information form. And this is the document that you'll be submitting with your application. It's going to include all about your organization, contact information, fiscal sponsor, project coordinator, total project amount, geographic location served, project start date and end date. And then this is just a screenshot of the application. There are different components in there that require you to write how you're going to handle each one of those items that is being requested. A timeline, some of you are familiar with the timeline, and this is a working document. So you will submit an initial kind of like a timeline of how you see this happening, as well as a plan of work of how you're going to go about doing this. Once that information is received and whomever is awarded, our awardees are awarded the grant, then the National Council will also be working with you on some of those components of the timeline and work plan. You will need to submit a proposed budget. I just want to mention, you can see on the screen at the bottom, there are several tabs. The tabs that you will be working with is the budget narrative tab, and then year 1 through year 4 proposed budget tabs. Okay, the last 2 tabs are cumulative, and it will pull all of the information that you enter in tabs 1 through 4 for your proposed budget into the cumulative documents. So we can see as a whole how much is going to be available from the Rapids, you're requesting from the Rapids Foundation. Other sources are in-kind support, and then total for the Rapids Foundation. And as Ashley mentioned, you will break out how much will be for the salaries of the candidates, how much for the supervision you're anticipating, exam prep, licensure fees, all of those things that you're anticipating will need to be in your budget. And then budget narrative, you just need to be very descriptive as to how the funds will be utilized and what you're requesting. So when you submit, you'll submit the narrative for each of those areas.
And I will say for that budget narrative, a lot of times what we're looking for is the calculations. And a lot of times it's, when it says narrative, people just think to describe what that line item is. But, we are looking for the calculation. So if it's like, it's, 3 people at $50 an hour for 100 hours, like that is what we're looking for with some of those things. If it's, especially the personnel piece, or, it's a part-time person at this rate. Another thing I want to point out is make sure you really pay attention to benefits. We have a lot of problems with nonprofits not appropriately calculating the benefits and then get into it and realize that they don't have the budget for it. So just pay attention to that. And then, if it's a line item where you're grouping a whole lot of different things, like if it's materials, or, if there's several big line items in there, to not just say it includes all this, but just to give a rough estimate of, we think it's this much for different things. You don't have to go into, every single thing you want to purchase, but to, provide enough information where it's not just one giant lump sum with a whole bunch of different big categories in it.
Thank you, Ashley. All right. We also have the proposal signature page, and those require to be signed, just attesting that you are affirming authority to submit this intention for funding. And so it will need to be signed by the appropriate people required, including the officer of your board. All right, some additional supporting documents are optional as letters of support and list of your board members. All right, so we've been through all the overview, so we'll go back to questions and see if anybody has any additional questions regarding the opportunity here for funding.
And it can be questions about the first section or questions about the second section as well. So whatever you would like to ask.
Just quick, how many letter of support do you need? 1 or 2?
How many letters of support? Since it's optional, I mean, it's kind of up to you how many you include. I mean, I think, always more is better to an extent, but yes.
Thank you.
Anything else?
Well, I do have one more question. Ashley and Angela, do you envision that that let's see how to put this. If there's $40,000 that the candidate is going to receive, do you believe that the institution, that LC or NSU or whomever the institution is, would we serve as a pass-through for that 40,000, or is that 40,000 something that the Rapides Foundation will hold on to and then pay directly either to the candidate or the candidate's employer?
No, it would be a pass-through. So that would be the responsibility of the regional chair, would be to distribute those funds to the placement site for their jobs.
Understood. Thank you.
And I will say too that for the other states, for the other model, the National Council has served as the pass-through. So depending on the structure, and we're there to support the regional chair. You guys will set up of what that will look like, but that's a part of our support for that first year of launching, is supporting you all and thinking through some of that infrastructure if it's needed.
Thank you.
And so, I mean, I think, goes to your budget, Steve, is that, that is a requirement from your financial office or from your accounting people, that, to make sure you check in with them to know what that's going to look like, how that will look. And if there is, if that's something that that the organization is willing to provide in kind, or, is that's something that's going to need to be put in the budget.
Okay.
Yeah, anything else? I mean, we've got plenty of time. This, we're here to answer questions, and there are no bad questions. And so please, I mean, keep them coming if you have more.
Or do you have candidates ready to go today? She said yes.
I have one more question, actually, you said it, so we have some student who will be graduating in May. And then they are already started looking at the site and get all that stuff. So by the time we will start in July, they will be in 2-3 months into that program. So as we were discussing before, that we should have a new student who are graduating in December. So
I don't think they have to be a new student. They just don't have to be very far into their supervision of getting those clinical hours. So, I mean, they could have been out of school for like 5 years, 10 years. That doesn't really matter. I think the more important thing to focus on is, if they're already in the process of getting those supervised hours and work and having that support, and they're already gathering those hours, then there's no reason to use our funding to support something that they're already doing and that they're already able to accomplish. So, I mean, the idea is to provide the supports for people who have not started, who do not have a supervisor yet. They're not working on those clinical hours. They might not be in a job that allows them to get those clinical hours. And so it's really to remove some of those barriers for those who have been in the workforce for a while, and also definitely to help those brand new graduates that are just coming out of school.
yeah.
Well, and it's all about getting the services to the people and making sure that they can get the behavioral health treatment and services that they need. And the workforce is such a huge challenge, and the universities do a great job of training them and graduating them, and there's just that gap and additional support that's needed afterwards. So this really helps address some of that. And I know y'all have got students that are interested in looking forward to this, but I mean, Angela and I have had the opposite end, people who have been in the field for many years that are like, oh, I've always wanted to do this, but I didn't have the time, or I didn't have the supervision or the money, like all these barriers. And so they're excited about that too. I think what's really also important to be thinking about is those placement sites. That's going to be a key part of this, is finding placement sites that are willing to work with the candidates and the supervisors. And National Council will provide some more technical assistance on that. But y'all know more than anybody what the licensure requirements are and what they need to be doing at that placement site to meet those requirements. So I think that's really important to be thinking through, as you're thinking about placement sites. Are they going to allow these non-licensed people to get the type of experience that they need to get those clinical hours? And y'all know I'm getting a little way out of what I know here, but y'all know what is needed for those licensures. I did want to reemphasize sorry, I definitely have a cold. I did want to reemphasize the focus of, the placement sites do need to be in our 9 parishes, or they need to be providing services in our 9 parishes, and these people will be working in our 9 parishes to provide services. But I also did want to emphasize that we're really looking for, priority sites would be those who are serving the uninsured, the marginalized population, and also nonprofit providers as well. And to really focus on those rural communities as well, focus on those communities that don't have as much access and as much services as some of the other places. So when you're thinking about placement sites, really think about where's the need and where could these new candidates have the biggest impact and really increase access.
And here at the foundation, we've had organizations telling us a great difficulty that they've had recruiting these type of roles. And so, these are in rural areas, so we know there is a need. It's just, how can we help them?
What else?
All right, I'm gonna poke my toe back into the pool.
Absolutely.
This question is for the National Council, and if, is it accurate that Anthony Carter and Rachel Kessler are the 2 reps from National Council?
And there's also a third person on the call from National Council as well, who's just sitting in to assist with the call.
Okay. So this is for National Council. You guys have spearheaded this in several other states, and I Colorado, Georgia, Washington, California, Hawaii. Surely there are some very valuable little pearls of wisdom that have evolved over the years. And I guess I'm curious about what sorts of things, if you were to ask those organizations, what did you wish you knew when you were just starting? Do you know can you share some of those insights?
That's a great question, Stephen. And I think, a part of why we're here too is those programs are still running and us to be a liaison and really take those learnings and support Louisiana in implementing that. I don't have a scripted answer just yet, but what I can say early on is even just from what you hear, it's an amazing program, but there's a lot of layers involved, right? There's Rapides, there's us, there's going to be the chair, the sites, the organizations, and setting up that infrastructure and expectations for all parties, the earlier the better, to help create an understanding and empowerment of all our roles will be very important. Especially, we just spoke to how important the sites will be. So that's going to be an important component to think about early on in that ramp up period over the summer of what is important qualities and characteristics for these sites to have, and what are the expectations that we're going to have for them over the few years to set up not only application processes, but contracts, and thinking about, we'll take learnings from the other states, but really just getting regional specific about what's important for Louisiana and what does that population need will be another component. And then similarly to when the candidates are either being selected or hired as well, setting them up with resources about what they can expect through the program, what are going to be the benefits provided to them, who do they go to for what, just a lot of that infrastructure, those first 6 months, the first year, is a high amount of effort, but will really set up success along the way. So I'll say that as one thing. I know there's more. Anthony, what else would you add?
Yeah, no, I absolutely agree with that. I think one of the things we didn't anticipate originally was how important the point of contact or the lead at the regional co-chair site was, in terms of like helping us launch the program. And so we had sort of an interim team that we worked with that, went through the application process, and they were the leads for that. But the actual person that was going to be implementing the program, it took a little bit of time to hire those individuals at each of the state co-chairs, or in this case, the regional co-chair organizations. And so just really thinking about if this is a new role, if this is an existing, person that takes on these responsibilities, but getting that person identified relatively soon and helping carve out that time that they're, going to spend in helping, invest and build that infrastructure that Rachel was just talking about is really key. And it took our original co-chairs a little bit of time until we served in that role, but that wasn't sort of very sustainable. I think the other thing that I would add too, and Rachel can speak to this a lot more than I can, is just the financial infrastructure management. And so sort of knowing what it takes in terms of like managing and setting up systems for the flow of dollars to the different sites is going to be really key as well. I know Rachel spent a lot of time thinking about that and building that out. And so that's something that you'd want to make sure that you're spending a lot of time thinking about and carving out.
Yeah. And so I think bottom line there for the regional chair, from what Anthony said, really important to have a lead from your end. And also to have, a balance and a team available and that infrastructure in place for a high amount of project management and infrastructure. And also that level of subject matter expertise, understanding licensure, being able to support the program participants. Both of those areas are going to be very important for success of the regional chair.
Yeah. I think contracts as well as like, finding supervisors, contracting with supervisors, paying those contractors for the time, are also pieces to consider in that, support and infrastructure as well.
Then, of course, the contracted agreements with Motivo and or Triad for that educational piece and training. component for them to prepare for their licensure, and then also the supervision if needed by Virgil from Mentivo.
How would one know? Let me see how to put this. If we say, okay, we want to budget for for all 30 candidates to benefit at least from I think I heard you say Motivo and Triad. Um,
How
how
would you
would
determine the cost?
yes.
Yes. So, I mean, I would think for Motivo, well, let's start with the easy one first. So for local supervision, if you're like, hey, we want to do supervision locally, we know either we have people on staff that can do that are options. We also would like to use people in the placement sites, which is also an option. Or, we just know people that can offer this local supervision. So you might have an idea of an estimate of what they charge hourly, and how many hours are required. So I think you could figure it out that that local supervision piece. And then it's Rachel, I mean, maybe you can say how you see this going with Motivo, but it just might be a quick conversation with them of, hey, over 4 years, we want to provide 30 candidates with virtual support and see what it would be, and maybe average the two or take the higher one and say up to this amount is budgeted for supervision. Same thing for Triad is, I think just the conversation that you're applying for a grant and wanting to do this, what would their rates be? And, Triad is what the other program partners, accelerator programs have used. But, if for some reason you're like, I really love this other one and want to use them, I mean, we would, consider that, but we would say that, Triad is one that has been tested and tried with the other programs.
Got it. And Triad is test prep.
Yes, sorry, thank you.
And that's test prep for both the licensure exam, the NCE, as well as the exam for LCSW.
I think that's a national council question.
They have here, I'm going to link their website. They technically have it's a company owned by Triad called AATBS, and they have test prep for many different licensure types, including LPC and LPSW. And I just double checked Motivo's website as well. They do have general rates posted on their website, but I'm sure they would be open to that outreach as well.
Okay.
So I'll just drop links to the organizations in the chat for your reference.
Okay, thank you. Okay, so I got one more question. National Council, what sort of forum exists for newbies to learn from their more experienced brothers and sisters, like maybe an annual convention or something of this sort? Because I would imagine that many of the struggles that each of the different states have, they're going to be unique because each state has slightly different licensing exams, but and requirements. But I would think that there's many things that we could learn and share and benefit from the relationship and a regular chance to communicate.
Great question, Stephen. That's something we're thinking through as well. This program in Louisiana, the role of the regional chair might look slightly different. In fact, it's going to be a little bit more ownership of the model. But we are thinking of potential opportunities to make those connections among chairs, rather than just having us be the liaison. We don't have an exact answer of what that will look like just yet, but that is a benefit of us being involved, is that we want to make those connections for you as well. I will highlight, thank you, Nidhi, my other colleague, just flagged. The National Council hosts a monthly workforce solutions jam. It's a public webinar open to anyone that talks about workforce challenges. We actually highlighted the program in Georgia back in December. Again, the model will look a little bit differently, but I'm happy to pop a link in there if you'd like to hear and listen to an example of what it's like for that regional. They have the regional chair in Georgia speaking. They have a program site and a candidate all on that program as well. So again, the model is going to look a little bit different in Central Louisiana, but I think it might be helpful to hear that if you want to get more familiar.
And I also will make a plug for the National Council annual conference, NatCom, that takes place in May. It is not specific. It is not specific just to behavioral health workforce. It is a huge conference that covers many topics in behavioral health. But I'm sure with all of those different pieces, there is a workforce piece to it. So I think that could be something else that you might be interested in checking out. As well. Great resource. Angela went last year. It's amazing amount of information as well, and would be great if you're looking for some opportunities around mental health.
And I think that was one of the components of the RFA, is to provide opportunity for national and state conferences as well.
And so when we jump into the jargon and start talking NatCon, you'll know that we're talking about National Council or their conference, or we'll try to stay clear of the jargon.
Excellent. Thank you for the link.
Mhm.
Okay, I kind of have a question. It's not really about the submission of the grant, but it's probably to the National Council. And if this is one like it's jumping the gun or you can't answer, just say, hey, can't, it's fine. But I was just thinking forward, like you're experiencing this with other states. They've been doing this. And I'm assuming many of them have reached like to where the initial candidates have gotten their licensure in that 2-year period, and they've worked that 2-year period, maybe. Are you seeing that the providers are able to keep them like beyond that? And I ask that because I know we are a rural area. So some of the providers I'm thinking about too who would benefit from this, I mean, I'm just seeing, is this something that's sustainable for them once we are not able to help like with a stipend or something? And if you can't answer that question, I understand.
Yeah, so no, it's a great question and something we'll probably have to get back to you on, because the initial start of the first candidates was fall 2023. So we're about a year and a half in then. And I know it's something folks are thinking about. Anthony and I aren't leading in some of those states right now. And so with the regional chair, we would definitely take some of those learnings from sites about retention, because I know that's a huge priority for Rapides as well, is to keep folks in the area. So,
and Sherry, I mean, I with some of our other grants, they don't have, I mean, by committing and taking a placement with this organization for 2 years doesn't mean they have to stay with that organization after the 2 years is over. We would really hope that they do, and we would really encourage that they stay. But that is not a requirement that they stay with that placement site. The requirement is that they stay within our 9 parishes. And so if if that placement site can't keep them on because they can't afford them, or maybe it just wasn't a good fit, as long as they just stay in our area with another organization, using their licensure, then that would meet the requirements for that we're looking for.
And the same will be true for, I'm sorry, the same will be true for if they start private practice in those areas, right?
Oh, so if like after they got their license, they opened up a private practice
That is
in the service area?
Yes.
I would like for them to take Medicaid. Can I require that?
I think they have started. I am not sure, but as Sherry was asking question, so most of the people I see whom I work, like after getting license, they have their own
practice.
They work and they part-time, they have their own practice.
Yeah.
And the last couple professor, because their private practice was growing so fast in these 3 years, they said, we do not even have time to teach. We want to just have it full time. So
let us think about that one.
Mm-hmm.
Let me think about it.
As long as they are serving our community, right?
Right.
That's
Right.
what our purpose is right now.
Yeah,
But
And it's
yes, giving back to community too. If they are doing private practice, they can be
yeah,
wiser later on.
yeah. I mean, yeah, they would.
And I mean, we want them to be working in our service area. So
Yeah.
at this point, we know they're gonna potentially open their own practice if they're a LPC.
Yeah.
I can see that.
Mhm.
Steve, I know you're gonna ask at some point, so I'm gonna go ahead and just mention some of the metrics that the National Council is looking at for their other grants and their other program. It's goals that they're looking at is increase a percentage of licensed providers, increase the number of patients served, increase diversity of licensed providers, and improve the HRSA shortage scores. And so I know you're a metric guy because I deal with you with your other grants. But that's just some things that they're looking at. Doesn't mean it'll be exactly what we look at.
I think some more short-term goals that we have been talking about, as you know, because we're talking about increasing access. And so I think I have seen some of the other programs report metrics of how many hours have your candidates provided treatment, like how many clinical hours have they actually provided. So I think that is something that we would probably want to collect as well, is so you can say, hey, this program provided an additional 40,000 hours of treatment, behavioral health treatment in our community through the support of these candidates. So I think that's a number that we'll be looking at as well. I'm trying to.
I think it was supervision hours, how many total supervision hours, and then total clients served.
Yeah, total client service would be the other one. So I mean, that is something that, when you're making contracts and agreements with the placement sites, is to figure out how to collect some of that data as well. And I think that's, conversations for later with the National Council of what that looks like, but did want to, as Angela said, put that on your radar, that there will be some data collection that would have to be collected in partnership with those placement sites.
So
oh yeah, go ahead, Steve.
at the risk of looking naive, tell me what HRSA is. The HRSA shortage scores.
Oh, what does HRSA stand for? It's the Federal Organization for Human Resource. I don't know if anybody wants to help me out.
And
Help me out.
Service Administration, I believe.
There you go.
Oh, can you say that one more time slowly? Because I'm writing this down. I've got a cheat sheet I'm writing on.
It's the Health Resources and Services Administration.
Health Resources and Services Admin.
Yeah, and Rachel just dropped a link in the chat to that data finder that shows the professional shortage areas. And I apologize, Steve, for using acronyms. So we're so used to just saying HRSA that I don't even know what it stands for anymore.
And Steve, it's a great tool. You can go out there and sort by your parishes, and it'll really tell you how many they're projecting as a shortage in that community. And it really is a great tool.
Oh, cool. And so I scribbled down some of the metrics. The change in the percentage of licensed providers, the breakdown of diversity of said licensed providers, HRSA professional shortage metric scores, how many hours of mental health care are being, how many hours of mental health care are being generated, how many supervision hours, and the total number of clients served. And I heard you say that those are not all the ones those are not necessarily going to be required of the Rapides Foundation, but these are the kinds of metrics that the National Council is looking at.
Mm-hmm. And I think by the time the grant award is awarded, we will have like finalized metrics of these are the ones that we are going to require grantees to select. And if that's like if you need that before then, we probably can get you a solid list, but we just don't have it right now.
Okay.
And Rachel and Anthony, if y'all want to jump in any other metrics that you think were super important or that y'all are collecting that we didn't mention, please do. We won't hold anybody to it.
No, I think those are key ones as far as impact for the overall program, and there will likely be other things tracked that's decided with RAPIDS as well around like program implementation tracking as far as, for example, candidates retained, like, are we onboarding candidates and are they staying? Because it's possible, they might leave within the time period. So I think there will be metrics around impact, which was what was mentioned, and then there'll also be metrics related to program implementation.
Angela, did you have anything else presentation wise? I think we reached the end, huh?
I think we're at the end.
Yeah.
So we thank you guys for being willing to participate in our informational webinar today. We definitely appreciate the council, the National Council, for joining us. We've been working hard with them for months, getting ready to have this opportunity available to our communities. And we're so excited that we've been able to partner with them and to bring this opportunity to the area.
Yeah.
So.
And thank y'all again for time. And I just realized we ran over, so I'm sorry. Thank y'all for staying with us and giving us a few extra minutes. And definitely take advantage of that pre-submission consultation. And y'all know where to find us if y'all need us.